Hello, I'm Tom Brett. I'm Director of the General Practice of Primary Healthcare Research Unit at the School of Medicine, the University of Notre Dame, Fremantle in Western Australia. I'm talking to you today from Fremantle, which is part of the port city of Perth in Western Australia. And the reason I'm talking to you today is to tell you about our new data extraction tool, TARB-Ex. TARB-Ex has been designed to extract clinical information from a patient's medical records and help facilitate the diagnosis of potential familial hypercholesterolaemia in primary care. The really important thing about the ability of TARB-Ex to extract this information is that most cases of FH worldwide are missed. It is estimated that less than 10% of affected individuals are currently being diagnosed. Left untreated, men with FH will develop cardiovascular complications in their 50s, while affected women will do so in their 60s. Primary care is ideally suited to facilitate this diagnosis. One of the reasons for this is that there is widespread use of electronic medical records in primary care. Thus, it is easy to integrate detection and management of the condition as part of routine clinical practice.
TARB-Ex was developed using structured query language technology and originally designed for best practice clinical management software, although it can be adapted for any EMR platform that operates on an SQL database. The program applies a standard algorithm, the Dutch Lipid Clinic Network criteria, to the practice EMR system in order to identify patients at potential risk of FH. This is how the screening process works. First, all active patients attending the practice are identified. Pathology records are then automatically searched and all active patients with elevated cholesterol are returned. Prescription history is then searched and a correction algorithm is applied to estimate pre-treatment LDL levels for any patients who are on statin therapy within 6 months of their highest LDL reading. TARB-Ex then searches the practice database for the remaining elements of the Dutch Lipid criteria. From this extracted data, a Dutch Lipid score is automatically computed for each patient and a medical record extract is produced with the relevant information. The doctor can then review the list of patients to identify those with high Dutch Lipid scores and review their medical extract to decide whether clinical follow-up is required.
We evaluated the electronic extraction method against a manual review of records performed by an independent GP. And we found that it compared very favourably, especially in terms of workload and accuracy. Probably the main benefit would be to increase the awareness of FH at the consumer level, the general population level, and also at the practice level amongst GPs, primary care physicians, practice nurses and practice staff. In fact, some cardiologists and pharmacists can benefit from it as well. The consensus statement of the European Atherosclerosis Society recommends that most individuals with FH should be managed in primary care and preferably in a family context. Access to specialist hospital clinics should still be available for more complex and hard-to-treat cases. We're hoping to extend this study to other practices in Australia to evaluate the widespread application of it. We hope you find TARB-Ex extraction tool useful in targeting potential FH patients in your practice. Thank you for listening.